Hello guys, welcome back to my channel. My name is Monu and in this video I'm going to give you some information on PLAB, PLAB, which stands for Professional and Linguistic Assessments Board. Now this PLAB is going to get replaced by UKMLA, which is United Kingdom Medical Licensing Exam, which will start from 2022. So approximately after 4 years, PLAB will be replaced by UKMLA. The number of questions and the number of hours and how they are going to give results will change in case of UKMLA. But for now it is PLAB, which helps you to get a license in United Kingdom. Before we head on to the exact PLAB here, I would like to first tell you about the structure, the healthcare system of United Kingdom. So first of all, the student must have cleared med school. You must have a certified medical degree. After this you are supposed to enter foundation years, which are of 2 years, first and second year. Now this is same as internship in India, Ukraine or anywhere else in the world. But if you are going to do it in UK, it will take 2 years. So internship of India is of 1 year, whereas internship in UK is of 2 years. FY stands for foundation year, also known as house job. Like when you are going to read some articles on internet, don't get confused between foundation year and house job. Also house job and training. So house job is internship. Now there are 3 ways that you can become a consultant in UK. First one is through CT and ST, core training and specialty training. Core training is of 2 years and specialty training is of 6 years. Let's say if you want to get a specialization in medicine. So your steps will be, first you'll get your medical degree, then you'll do foundation year either in your home country or in the UK. Then you'll go for core training, which will be of 2 years, CT1 and CT2. And then you'll enter your specialty like medicine, surgery or psychiatry. You have to go through this way for these 3 specialties: medicine, surgery and psychiatry. So this takes about 6 plus 2 is 8 years. So it takes about 8 years to become a consultant. The number of years here, you work as a training. When you're going to read like blog post, training means you're going to work as a doctor under CT and ST training. So you become a consultant in UK after 8 years if you want to pursue your postgraduate, if you want to pursue your specialty in medicine, surgery and psychiatry. The another way to enter UK is to give med school, to finish your med school, do foundation year, go through run-through training. This is very common, common against IMGs, International Medical Graduates. This is again the same, number of years are same as in case of CT, ST and run-through training. But you don't have to go through first you have to go through CT or ST. It's just straight 8 years process and you work as a consultant. They don't consider you as a trainee. Now you have to go through this process if you want to get specialization in pediatrics, ophthalmology, neurosurgery, pediatrics and radiology. So let's say if you are a 4th or 5th year medical student who want to become a neurosurgeon, so you'll go through this run-through training, not through CT and ST. So decide your specialty before and then go through your ways. The third way you can enter is finish your foundation year and work as a general practitioner directly, GP, or ST, that is specialty training 1 to 3. It takes about 3 years for you to become consultant through this way. But it is only for family medicine. So this is according to your specialization. Now there are 3 ways that you can enter UK through: PLAB, MRCP, FCPS. In this video, I'm going to give you some information about PLAB and MRCP. FCPS, I don't have much information, I'm sorry. But about PLAB and MRCP, we'll talk. Now, PLAB is a licensing examination. It is a 2-step process, almost similar to UKMLA, but there are huge differences between both of them. Few basic points: there are multiple attempts in PLAB. 4 number of attempts. If you don't pass it in first attempt, you can give 4 times. But keep in mind that PLAB consists of 2 parts, PLAB 1 and PLAB 2, and you have to finish this both part within 2 years. Within 2 years. Keep this in mind. Score doesn't matter. I'll tell you about the passing scores, but as in case of UKMLA, your every single score matters, but in case of PLAB, you just have to pass it. You don't have to top the exam. Obviously, if you'll top it, it will be better for you, but score doesn't matter at all. Third is single best answer. In case of USMLE, you have to choose the correct answer, but in case of PLAB, you have to choose single best answers. All the answers are correct, but you have to choose like which one is the most appropriate. Another thing about PLAB is you can only give this after graduation. Now this can be a pro and a con for students. Like you cannot give it before graduation. Once you have got your medical degree, you can give it after your graduation. Another point is which people often ask about, that does our medical marks matter for PLAB? Because PLAB scores doesn't matter, MBBS marks doesn't matter. Then what matters in this UK healthcare system? I'll tell you about that. But your MBBS marks doesn't matter. Now about the PLAB exam, part 1 and part 2. Part 1 is about multiple choice questions, which is written examination, which can be given all over the world. Now it tests only clinical subjects. PLAB is only about clinical subjects, whereas USMLE is about preclinical and clinical both. So in the first part, clinical subjects such as medicine, surgery, obs and gynae, ophthalmology, psychiatry, ENT. So these are the subjects that you need to that you will be tested against. Now, not all of them are important. Medicine consists of about 90% of the questions. So most of them are about internal medicine clinical questions. For part 2, it is clinical examination, like patient-doctor interaction, and it can only be given in Manchester, England. So you have to travel to UK to give PLAB 2. Another part, PLAB 1 consists of 200 multiple choice questions, and the passing score is about 60 to 65%. It changes every year. So let's say a person scored 60% and another person scored 90%. It doesn't matter at all. You just have to pass this exam. You can give this exam in March and November. It depends, like every country has their different time of the year when you can give this examination. For example, in UK you can give it in May and December, whereas in case of India and Pakistan you can give it in March and November. The application fees is about £230. Step 2, it consists of 18 questions. Like there are 18 different patients that you'll see. Every patient consists of 3 parts. Like when you go and see a patient, you'll be scored against 3 parts. First one is history taking, which is 4 marks. Like you'll be given 1, 2 or 3 depending upon how well you take your history. Another one will be management. You're going to prescribe, like you are going to give management, and 4 marks for the same. And the third one is interpersonal skills. The intrapersonal skills is the most important part here. I'll tell you why. Once you're going to see a patient, you have to talk very kindly to them. You must be a generous person, like your voice must be soft, and you must be a very kind person to get great marks in interpersonal skills. That's what matters. When you're talking to a patient, you need to be polite to them. It also consists of 4 marks. So 4, 4 and 4 is 12 marks. You are tested against 3 parts: history taking, management and intrapersonal skills. Each one consists of 4 marks, so total is 12 marks. And the passing one is 6. You must get 6 in each of them. Let's say you got about 1 marks in history making because you were not paying attention to the patient when you were taking the history. And you got about 2 for the management. And you got about 3 for the interpersonal skills because you were very polite to the patient. So the total is 6 marks. So if you get 6, you have passed the system, the first patient. So this is how the PLAB 2 works. It is very easy exam as compared to PLAB 1. Now for the process part. Let's say you are in the last years of your medical school and you want to give PLAB. How you must process your application, how you must apply for the examination and everything. The first part is to graduate, get graduated, finish your MBBS. You cannot give this exam before graduation, keep this in mind. So once you have graduated, you'll set up your GMC account. I'll put the GMC's link in the description box below. So let's say I'm from VN Karazina. I'll verify my degree from the university and from the GMC account. Once I have got my degree verified, the second step would be to give IELTS examination. Now you can do IELTS before this verification or after, depends upon your time plan. But for my case, I would have preferred to give IELTS during my last year. Let's say you are going to get graduated next year, you can give IELTS this year. You have to score a minimum of 7.5 bands. There are 4 parts of IELTS. You have to score 7 bands in each of them, and overall should be 7.5 bands. Now IELTS is valid for 2 years. So plan accordingly. You have to give IELTS and then PLAB 1 and PLAB 2 within 2 years. Third part is to give internship. Third part is to finish internship. Now I would like to get your attention on this point. Let's say you wanna go for psychiatry specialty. What you can do is, the one way will be to finish your MBBS, go through foundation year as per UK, 2 years there. Then you go for 2 CT and 2 ST, 6, 2 and 2. 10 years to become a consultant. But another easier way that most people opt for is to finish their internship in their hometown. So if I have finished my MBBS, I can go to India and finish my 1 year internship, and then I would save my 1 year. So this is what you are supposed to do. Finish your graduation, go back to your home country and finish your internship. 1 year. It should be exact 365 days, not even 1 day less than that. Out of which 3 months for medicine, 3 months for surgery, and 6 months according to your wish. Let's say you want to pursue in pedia or neurosurgery, so that would be your 6 months internship. Keep this in mind. You do not have to get internship less than 1 year, not like 362 days, 363 days. This will replace your foundation years here. The fourth step is to give your PLAB 1 exam during this internship. Now if you're going to get your internship in India, it is difficult to get time to prepare for PLAB 1 and to give PLAB 1 actually. But I think that's the least option that you can do to save your time. You can give PLAB 1 exam during your internship. Fifth will be to prepare for PLAB 2. Now PLAB 1 is easy. You can give it in any part of the world. But for PLAB 2, you have to prepare yourself financially and your visa documents. Now visa is one of the most talked about topic when you talk about PLAB, because it is easier to get visa for America, for United States, but it is a little difficult to get visa for United Kingdom. So you must prepare your visa documents well. I'll tell you about the documents here, what all things you need. And you also need to prepare financially for the visa. So prepare for PLAB 2. Also book 15 to 25 days clinical practice. Let's say you're going to give PLAB 2 next month. What you're supposed to do is go at the end of this month and practice there. There are 3 academies in the UK that you can practice: Swami classes, Hamad classes, and Samson's. So you can go there in group. If you go there in group, you will obviously get discount. Like, it is something like, if you go in a group of 5, you get about 20% discount on the coaching classes. It costs around, I don't remember exactly, but around £300. They give you the dummies and you can practice all the clinical things. So you should book that, and you should go a month before your PLAB 2 exam to UK, so that you can practice and you'll be very confident. You can skip this step if you are very good at clinicals. The 7th step would be to apply and give PLAB 2. Once you have cleared your PLAB 2, the 8th step would be to come back to your home countries. Obviously, you're not going to stay there. You'll get a short-term visa. So you'll come back to your home country and you'll apply for your jobs. You'll enter UK for training. You'll get your GMC registration. Once you have finished your PLAB 2, you'll get GMC registration, and then you'll go for like government jobs or private jobs. There are 2 types of jobs in UK, NHS and NES. NHS gives you government job, which most of the people obviously want. Another one is NES, which is private jobs. So this is it for this part. When you enter UK through this way, you'll directly go in the CT part, core training. So you understand 2 ways, right? You can give foundation year in UK, then you can go for CT/ST. Another way, you can do internship in your home country and then directly go to UK for core training. The number of working hours during your trainee job is about 48 to 50 hours per week, excluding your night shift. About the visa part here, very, very important. Number one thing, I'm not sure about this point, but if you have a single name in your passport, let's say Vishnu Pratap, if you have a single name Vishnu in your passport, it will be a problem for you to get visa for UK. So it is better to correct your documents before planning for all this. If you are in 9th or 10th, if your brother and sisters are in 9th or 10th, please get their name changed. You must have a double name to get visa. First point here is get a job. If you have done your internship here and let's say you are doing any job in India or any job all over the world, it will be easier for you to get visa. Why? Because what the ambassador want to see, what the person who is gonna grant you visa, they want to see that you will come back to your home country. That is, it will show your home type. They don't want you to settle down in UK for all your life. So at the time of the visa granting, you need to prove that, okay, I'll come back to my home country. So you must get a job in your home country. It will prove. Second is to get an income. It is better if you do your internship and then maybe 2 or 3 months job in your home country to prove that, okay, I am financially stable and I have some home ties. I'll come back to my home countries once I've done this trainee job. Another thing is to get a bank account. If you don't have a bank account yet and you are relying upon your parents' account, please do get a bank account. You have to get a bank statement of at least 6 months. When you are going to collect your visa documents, the most important document here is to get a 6-month statement, bank statement, and get it proved by the bank. Third point here is £3,000. This is like the average money that you must have in your account to get a visa. You need to prove that, okay, I'm going to UK to give PLAB 2 and I'm financially stable and I have £3,000 in my bank. So I won't be broke then. So you need to have about £3,000 in the bank, and that bank statement should be verified. For the bank statements, what most of the people do is, if you are not financially stable, what you are gonna opt for is you'll try to get money from, let's say, relative, 10 lakh, 15 lakh at a time, and you'll directly put it into the account, which is very stupid. Because you are not supposed to put all the money in your bank at one time. If you're going to give PLAB, please plan ahead. Put the money 8 months, 9 months, 10 months before getting this statement. Next one is explain sponsorship. Let's say you are a medical student who just finished the graduation and who has done with IELTS examination, and you want to give PLAB 1. You are done with PLAB 1 and you want to do PLAB 2. But you don't have a job or an external source of income. What you're going to do is get a sponsorship. You can get sponsorship from your family, from your parents, or from your close relatives. But you have to explain the sponsorship. Let's say I want to go to give this PLAB 2 examination and I'm taking money from my father. I need to get a cover letter from my father to explain why he's giving me this sponsorship. Like, he'll write a letter and he'll sign one document like, okay, I'm giving this sponsorship for my daughter to go and give this PLAB 2 examination in Manchester. So these are the visa documents that you'll need. Another thing here is about the books. For IELTS, you need to learn from Cambridge and Oxford books. About 2 months of time is appropriate, I think. Second is Samson's notes. Third one is 1700 question, which is like the most talked about question, which most people rely upon. 1700 question plus mock test, 7 mock test. This will be a total of 3000 question. Now this is like the gold, you can say, for the PLAB examination. I have seen people who have finished this PLAB 1 and PLAB 2 just on the basis of this 1700 question. So if you are clinically strong, if you have studied during your med school, you won't need to worry much. Just go through these questions, read the explanations. Don't cram questions because you have to choose single best answer. So go through these questions. The fourth one is Oxford Clinical Handbook. Now what most people do is they go through handbooks. Like, they want to read review books, handbooks, as many books as possible. But this is very stupid of you to do that. Instead, focus on questions. Focus on the clinical questions here. Only go for Oxford Clinical Handbook if you're confused about something, if you just want to take a recap of the topic. Don't cover this book cover to cover. It will be very bad. Fifth one is Dr. Khalid questions. Now there is a long list of books that you can read for PLAB 1, but these were the most important one. 1700 question, mock test, and Dr. Khalid's question. Now it is same as these 1700 questions, but with different explanation. Now you can get many groups on Facebook or generally on the web where you will find these questions subject wise, topic wise. Do whatever is appropriate for you. Another thing about money here, though I have made another video about the financial aspect of all the examination, but still I'll cover the main points here. The total expenditure from first part, that is your GMC account, up until your first day in UK, it cost about £6,000. Now when I made the last video about the financial aspect, most of the people were commenting like, hey, don't you think the expenditures are a bit high? Don't you think these are a bit low? Now this is just the average that I'm talking about. So from first to last, it is about £6,000, including your exam, including your traveling, including your coaching classes. Another thing is, when you go there, first month will cost you about £3,000, and you'll start to get money from first day, but you'll get monthly income, not like daily income. You'll get monthly income, and you'll get your first month salary at the end of the month. So you will get your £3,000 from your parents. Then at the end of the month, you'll get about 2,000 to 2,500, depending upon if you're doing night shifts or not. So you'll get about £2,000 at the end of the month. You can cover your expenditures properly. I think I have covered all the points about PLAB. If you have any questions, drop them down in the comment section below. Another part is MRCP. Now MRCP is, like, for you to understand it, PLAB is like your NEET examination or FMG examination for Indians, and MRCP is like PG examination, if that makes sense. For PLAB, you'll go this way. For MRCP, if you give MRCP, if you are like the toppers of the class and toppers of your universities, please go for it. Please go for MRCP and you'll enter ST3 directly, this one here, or half of this. So you saves about how many years? 3, 2 and 1. Oh, one is necessary. 3 and 2, 5 years. Let's say you have the eligibility for MRCP is same as of PLAB. 2 requirements, IELTS and your degree. So you can go through this way, PLAB way, which is a bit cheaper, and you start from basic. It is better to enter any country from the basics, like go through steps. But if you want to enter like all of a sudden in between, MRCP would be the way. It will save you 5 years, but you need to be very well prepared. The exam costs about £840 for one exam, and it consists of 3 parts. So I'll try to make another video on MRCP, but this is what general people go for. For MRCP, there is no need of PLAB. You'll just directly enter into the ST3 program. The last part of the video about the links. If you have any question about the Samson notes or the explanation of the notes, you can go and check patience.co.uk to get better explanation. Second thing is PR. Now this is like very diplomat question regarding UK. Some people say you don't get PR even if you work in UK for 15 years. Some people say I have never seen in person who haven't got a PR. So I'm not sure about this point, but it usually takes, the official number of years that it usually takes to get a PR is 6 years. The third point is PG. PG is paid in UK. So keep this in mind. There are several options to do PG in England, PG in UK. You can do it without PLAB or with PLAB. But with PLAB, you can work in UK. Without PLAB, you can just study there, and you'll go back to your home. You'll have to go back to your own country to practice. If you are going to do PG, like if you are going through any consultancy or agency that gets you admission in UK, you can obviously study there, but you will not be able to practice. So keep that in mind also. Fourth point is cancellation of examination. If you cancel this exam 83 days before the scheduled date, there will be no money for the cancellation. There will be no cancellation charges. But if you are going to cancel this after 83 days, the cancellation fees is about £50. So this is it for the video. If you have any questions or queries, please feel free to post them in the comment section below. I'll try to answer them. And this is it. Watch, share and subscribe. Thank you for watching.